Hello everyone, I am Dr. Mallika. Welcome you all for the Facebook live session. Today we have Dr. Phanindra Kumar sir, one of the best surgical oncologists in Guntur. He has over 5 years of experience. He has completed his MBBS from NRI Medical College Guntur and has pursued his post-graduation in MS General Surgery from Andhra Medical College Visakhapatnam and also completed MCH Surgical Oncology from Usmania Medical College, Hyderabad. He is the lifetime member of Association of Surgeons of India. Here we have Phanindra Kumar sir to discuss about breast cancer. We welcome you sir on behalf of Aortic Tutor. Sir, first of all, can you explain the origin of breast cancer?
Breast cancer, the female breast contains both fatty elements and ductal elements. The ductal elements will be helpful for the secretion of the milk. The ductal elements are the source of the origin of the breast cancer.
Sir, how common it is? It is a rare or a very common disease?
It is very common in India and Western countries also. It is very commonly seen disease. Suppose you take in female patients, out of 10 patients, 5 patients are suffering with cervical cancer or breast cancers. So these are most commonly encountered cases in our setups regularly.
So what about incidence of breast cancer? Is it women or rare?
Now, breast cancer is very common in India setup and also Western countries also. Suppose you take 10 patients of female patients, out of them 5 patients are suffering with breast cancer or cervical cancer only. So it is very common cancer. So I want to discuss about breast cancer today. So it is most commonly seen in female patients, and in India every year around 2 lakh cases are detected per year in Indian setup, and also it is usually most commonly seen in older age patients, but incidence of younger is also increasing nowadays, but most commonly it is seen after 50 years of age.
Sir, is breast cancer can also be seen in males?
Yes, breast cancer is also seen in males, but it is most common in females. If you take around 100 patients, around 95 to 98 patients are female patients only, and male patients only we get only 1 or 2 cases only. But still it is possible to men also having breast cancer also possible.
Sir, what are the main risk factors for breast cancer?
For any cancer, there are some modifiable risk factors and unmodifiable risk factors present. And breast cancer also, 50% or 60% of the cases, there is no risk factor for breast cancers. So most of the patients will come to OP and ask us, we don't have any bad habits regularly, we don't have any family history also, but still we got the disease. So most of the cancers they get by unknown factors. But some risk factors are there, we have to know. They are obesity and lack of regular exercises, consumption of alcohol, taking smoking. These are all risk factors which we can change.
What are the common symptoms of breast cancer?
For any cancer, symptoms may be 3 types, like local symptoms, regional symptoms, and systemic symptoms, like metastatic symptoms. Cancer, suppose if you take a breast cancer patient, initially the lump will start in breast, then it progresses to nodal disease as a disease in the axilla of it. And if you still delay, there is progression to metastatic disease. They will present with metastatic symptoms. Suppose if patient with breast cancer, symptoms of lung metastasis like cough, pleural effusion, like shortness of breath. These are the symptoms of lung metastasis. Suppose the patient is having brain mets, he is having headache, vomiting. These are metastatic symptoms. Most commonly, if you the patient present to us early, they will have lump in the breast. So initial symptom is most of the patient, 80 to 85% of the patient have lump in the breast. So not every lump in the breast is a breast cancer. So we have to do regular clinical examination, and we have to decide whether it is malignant disease or benign disease by clinical examination. So most of the patient by apprehension, they will come to us whether they are having breast cancer or not by detecting simple lump while in the home. So clinical examination is very much important. So lump And progression of lump is also important. So if you notice a lump and within 2 months or 3 months the lump is increasing in the size rapidly, then we have to suspect it is malignancy. And associated symptoms like pain. Pain, most of the patient will not get pain in breast cancer earlier. If the disease progresses, then later stages they will get pain. And local skin changes, associated skin changes may be present, like skin redness or cutie orange, like orange peel appearance of the skin, or if you still delay, there is ulceration of the skin of the breast. And axillary, most of the breast cancer patients, they will present with the swellings in the armpit, so axillary swellings. So if any patient having breast lump associated with the axillary lump also, we have to suspect breast cancer strongly. So isolated breast lump, then we have to think benign diseases also. And breast discharge, nipple discharge. Nipple discharge is also another symptom. You have to decide whether it is breast cancer or not. So bloody discharge from the nipple underlying mass is highly indicative of breast cancer. But most of the patients without any lump with breast discharge, you have to think other diseases also, like cachexia and a simple papilloma. These are the benign diseases which presents with nipple discharge but without any lump. So lump with nipple discharge, we have to suspect breast cancer.
So how can we diagnose the breast cancer?
So first of all, clinical examination is very important. So whenever the patient present to you, clinical examination means like how hard it is, like consistency of the swelling is also important. The swelling is very hard and it is not mobile. That means the swelling, it is not mobile in any directions. That means it is fixed to the underlying structures. That is indicative of malignancy. And also hard in consistency. And these are all the associated axillary lumps. Then we have to confirm it by mammogram. Mammogram is the test which you have to do whether it is malignant disease or benign disease. You have to confirm it. So there are some scoring points for Birat's grading, like Birat's 1, 2, 3, 4, 5, 6. It is whenever it is 4 or more, it is highly indicative of breast cancer. Then we have to do breast FNAC, that is needle test. So finally needle test will confirm the diagnosis, whether it is malignancy or benign disease.
Is FNAC sufficient for diagnosis?
FNAC, most of the patients in the peripheral setup, they undergo there is no true cut biopsy facilities. So first and foremost investigation they will do is FNAC. FNAC will confirm it. But we don't get sufficient tissue of the tumor by doing FNAC. So for getting tumor tissue, we have to do true cut biopsy. True cut biopsy will give confirmation of the diagnosis, and also it will give tissue for further test for the further breast cancer. Hormonal test is very much important, not only diagnosing breast cancer, and further hormonal status of the patient is also very much important for explaining the prognosis, and also for treatment part also it is very much important. So even the patient comes with FNAC report to you, we have to do true cut biopsy for further confirmation of the disease, and also for further hormonal therapy also it is very much important. So it is mandatory to do true cut biopsy rather than FNAC for breast cancer patients.
So how can we know about the staging of breast cancer?
So staging is very much important for every cancer. So initial confirmation after doing biopsy, we will confirm the disease, but staging is important for treatment aspect. And also we have to explain to the patient about the prognosis of the patient. So every patient with breast cancer will don't have any equal survival rates. So staging is very much important, whether the patient is in stage 1, stage 2, stage 3, stage 4, we have to decide it before the therapy. Then we have to decide which treatment is suitable for that patient. So there are various options for the deciding staging. Like mammogram is the initial test for breast, and then ultrasound abdomen and CECT abdomen and chest, bone scan and PET scan. These are all modalities which will detect whether the disease is restricted to breast or it is metastatized to any organs. So among them, if the patient is affordable, whole body PET scan is the best, because it is a single test which will decide whether the patient is having any other diseases in other metastatic disease in other sites like bone, lung, brain. Every site of the body is detected by this single test called PET scan. That whole body PET scan is very much useful for staging. Then after doing staging, we can tell the patient whether the patient is in stage 1 or stage 2 or stage 3. Based on that, we can explain to the patient how much is the how effective is the treatment to that patient, and how is the prognosis of that patient. We can explain by staging.
So how to know the prognosis of patient with this cancer?
Oh, as earlier I told, true cut biopsy, we will get hormonal status also in breast cancer, like ER, PR and HER2. These are hormonal markers. So some patients are triple positive, some patients are ER, PR positive, some patients are triple negative. So all the three markers are negative. So how would this affect to the patient prognosis? Suppose if the same two patients with the same size of the breast lesion, one patient is triple negative and another patient is hormone positive, like ER, PR positive. So among these two patients, ER, PR positive patients will do good or will do better compared to triple negative breast cancers. So both are breast cancer only, but hormonal status is very much important in breast cancer. So triple negative breast cancer or HER2 positive breast cancers are bad compared to triple positive or ER/PR positive breast cancers. So hormone positivity is very much important in prognosis, deciding prognosis. And also patient presenting early to our hospital, like patient presenting with only breast lump without any axillary nodes or any distant symptoms, they are very good, having very good survival rates compared to patient presented lately with huge mass or huge axillary nodal mets. They have poorer prognosis compared to smaller lesions. So earlier detection is very much important in cancer. Not only for breast cancer, for any cancer, early detection and early treatment will have better prognosis to the patient.
Sir, surgery or chemo, which is the first option you have to choose for breast cancer?
So breast cancer, surgery is the first treatment of choice for most of the breast cancer if they present early. As I already told, in staging also, if the patient having breast lump only without any axillary nodes and hormonal status is also good, then surgery is the treatment of the option. And basically any cancer, only surgery, only radiation, only chemotherapy is the not treatment for solid tumors. So we have to give all the treatments, multimodality treatment. Cancer is a multimodality treatment. So most of the patients ask us, can we avoid surgery? Can we go only for chemo? It is not possible for breast cancer for avoiding surgery. Unless the patient is not fit for the surgery, surgical treatment is mandatory. So we have to decide whether we have to give neoadjuvant treatment like chemotherapy first, followed by surgery, or upfront surgery, like directly we can take her to the surgery. That itself also comes under staging, based on staging only. If the patient present is stage 1 and stage 2, we can directly go for surgery directly. Then after post-operatively, we send the patient to chemotherapy. If the patient present in stage 3 disease, then we have to go for chemotherapy, neoadjuvant chemotherapy, either 4 cycles or 8 cycles, chemo followed by surgery. This is the treatment of pregnant infant.
Is there any other treatment option, sir?
So basically surgical treatment, medical treatment, and like chemotherapy and radiation, and also hormonal therapy based on hormonal status, like letrozole, anastrozole, and Herceptin. HER2 positive patient, we can go for Herceptin for 1 year. These are all the various treatment modalities of breast cancer patients.
So what is chemo point?
So after surgery, we send the patient to chemotherapy. Chemotherapy is the giving drug through the intravenous system, through the veins. But usually we need 4 to 8 cycles of adjuvant chemotherapy for most of the breast cancer patients. So every time in between 2 cycles, there are around 2 weeks gap is there. So every time patient comes, we have to put new line to the patient and we have to give chemotherapy through that intravenous line. And some patients may require prolonged adjuvant treatments, like Herceptin positive patients may need around 1 year of treatment that drug. So such a prolonged period of time, if you want to give the drug to the patient, every time you have to give new cannula to the patient, you have to put new cannula. It is a cumbersome procedure, and some obese patient especially, where we don't get cannulization so easily, then there is a chance for another that chemo port is very much useful for that patients. The chemo port is basically, it is a port which is fixed within the subcutaneous region of the patient only. Suppose a patient with right breast cancer, we will put the chemo port on left side of the patient. So it is a 30 minutes procedure. We will keep the port. So port is nothing but a soft thing. It is a chamber with catheter. The catheter will go into central vein, central line like subclavian vein, major venous system it will go. So every time there is no need of putting new cannula to the patient. So we have to, we can give easily to the patient drug, we can give easily without any comorbidities. That is very much useful for the patient, that too obese patients and those who requires prolonged therapy, prolonged medical therapy. Chemo port is very much useful. And removing chemo port is also easy procedure only, just 5 to 10 minutes procedure only.
Sir, is any vaccines available for prevention of breast cancer?
So cervical breast cancer, you don't have any vaccines for breast cancers. So basically vaccines are for those cancers we get from viruses or bacteria. So infectious cause is there, then there is a vaccine's role is present. Suppose if you take cervical cancer, which is caused by human papilloma virus, which is a virus. So there is two types of vaccines, cervarix and gardasil. So cervical cancer, we can prevent it by giving vaccination to the female patients, especially 9 to 25 years. If you take females, if you give vaccines, they will be get benefited by the prevention of cervical cancer. But remaining cancers, most of the cancers, vaccination is not there.
Sir, how can we screen a breast cancer?
Screening. So as already told, the symptoms of breast cancer, lump, nipple discharge, these are symptoms. Screening for any cancer means patient without any symptoms. So a simple asymptomatic patient, if you do any test, by that we can know whether the patient is having breast cancer or not. That is called screening test. Screening is done mostly for asymptomatic patients. In breast cancer, so if the patient is without any lump after 40 years of age, if you do mammogram is the best test for the screening. So it is advisable for every woman after 40 years, annual mammogram is the best test for early detection. So even if it is negative by clinically, we can get radiologically some doubt of any lesion if it is starting early. So we can address that lesion, and if there is any possibility of cancer, then we can address very early so that patient is get benefited. So screening, mammogram is the best test for breast cancer patients.
Thank you, sir, for sharing your valuable information about breast cancer.